Just wanted to say a few words about the PBO report on water and boil water advisories, water treatment in First Nations across the country. And pleased to see the PBO is recognizing the significant investment we've made on capital infrastructure. Obviously been delayed over the last couple of years. COVID and many other things have created some challenges from a technical perspective, but the money is there in order to complete that work. The PBO did note that the challenge remains on the operation and maintenance end, and of course we are fully committed to closing that gap. Have been working with partners to make sure we understand what continues to be present in that gap, because at currently we're funding 100% of operation and maintenance, but nonetheless, clearly there's work to do in understanding what more we can do to make sure that communities not only have the facilities, but the people that are trained and capable to maintain those facilities and keep them running for years to come.
There's $140 million that is missing. Is it something that you're committing to actually put into the next budget to actually pump up this?
We're committed to doing whatever it takes to close that gap. So if it is $114 million, I'll be pursuing that money, but I will be working with partners as well to fully understand what the gap consists of. As I said, currently we are funding 100% of operation and maintenance. That's as of budget 2021. So, it'll be helpful to understand what is left to close in terms of whether or not it is a formula that needs to be adjusted. I know that this is very technical, but there was a new formula negotiated with the AFN and other partners 2 years ago. So we'll be looking at what exactly it means and will take to close that gap. But yes, I'm committed to closing it.
There's the Dryden Water Center that you probably don't have. I think it's in your
I do know Dryden. I don't know this particular situation yet.
They have a water center where they train First Nations.
Oh yes, is this a circuit breaker program?
Correct.
Yes.
So what about a partnership with them?
So we already work in partnership with the circuit breaker program, and they provide training and support for people that are seeking to become water treatment operators, but they also work with individual First Nations communities to help with that technical expertise to keep their particular systems working and in tip-top shape. Obviously, systems can be complex, and what the goal is to make sure that we have talent and expertise fully trained and paid equivalently as to other water treatment operators. I think this is something I've heard not prior to being the Minister of Indigenous Services, but certainly throughout my entire 6 years, that if there's a disparity between what the province is paying and what the First Nations community pays, that often people will take those skills and look for naturally higher employment opportunities. And so our goal is to make sure that people are compensated fairly and appropriately so that they can remain in their community providing those services.
Any update on the deadline for boil water advisories?
Sorry, I'll just take this fellow and then you. So I'm reluctant to set a deadline because I'd like to understand from the communities themselves what the barriers are that exist to end that gap. But I do have the deadline of as soon as possible and working fully with communities. There are right now 43, I think, don't quote me on the number exactly, but I think 43 boil water advisories left to address. And so we'll be working with each of those communities, and we are actually on the stage in which they find themselves, whether it's the preliminary work to figure out whether or not they have the appropriate land mass in some cases. Sometimes it has to do, with priorities. In COVID days, there was some challenges with getting construction workers into the communities. There was a higher prioritization of safety of communities from COVID, and of course, those things created some delays. So what I want to do is make sure that every barrier possible is removed from a community so that we can move as quickly as they wish to remove those boil water advisories.
Do you have a window of time though, like 5 years, 10 years? How is it supposed to be a point of accountability and transparency here if there isn't a deadline? I understand the operational complexities, but what window of time is the government looking at?
Well, I'll just say again, as soon as possible. I'm reluctant to put a window on because it is really about the self-determination of communities as well and working with them on the plans that they have. So I'll tell you this, whatever the barrier is, a community should tell me what that barrier is and I will look to lift that barrier. So in my mind, as soon as possible, but I don't want to put a date to the...
Right? Like I understand you're saying you don't want, but you not wanting to put a date also means you don't have accountability on actually ending it. Because in 3 years, you can just say, well, it's not yet as soon as possible. So how do you hold yourself accountable?
I think what the PBO report showed is that the money is there, and we have also the political will there. So we'll be working with First Nations communities to understand how we can make sure that we expedite the work and give them the tools that they need to move forward in this planning. This isn't something the government unilaterally can impose on a community. This is something that we do together with communities. It is about self-determination. It is about providing people with the equitable funding, with the support and the structure to get the work done. And like I said, I will work with every community that wants to meet with me, and certainly I look forward to talking to each community in the weeks to come. Thank you very much.
Jusque-là, vous avez parlé à vos homologues des provinces hier quant à la possibilité d'imposer des tests pour les gens qui arrivent au Canada des États-Unis. Est-ce qu'il y a consensus?
Alors, dont on a parlé, effectivement, c'est un des mesures qui ont déjà été annoncées à la fois vendredi et hier. Je pense que tout le monde était d'accord que ces mesures étaient importantes. Deux, on a aussi échangé sur l'importance potentielle des troisièmes doses dans le contexte actuel. Et on a tous convenu qu'on allait attendre l'avis du Comité consultatif national sur l'immunité. Et trois, on a effectivement envisagé d'autres éventualités à titre préventif, dont celle de prévoir ce qui se passerait si on avait besoin de mettre ces mesures en place pour des arrivées du sud de la frontière.
Alors, on en est où exactement par rapport à ça? Qu'est-ce qui fait que vous ne le faites pas?
Bien, pour deux raisons. Un, il n'y a pas nécessité de le faire maintenant. La situation aux États-Unis est totalement sous contrôle. D'ailleurs, on ne connaît pas encore un cas à ma connaissance. Il y en a peut-être un aujourd'hui, mais bref, la taille du pays fait en sorte que la situation, de toute évidence, est sous contrôle, que leur système de santé publique fonctionne efficacement. Mais on va suivre, comme toujours, la situation, et on a convenu qu'on allait le faire avec les provinces et territoires.
Can we get some clarity specifically on what you announced yesterday regarding the on-arrival testing and then isolation? Specifically for people who are traveling now, booking travel, when does it take effect? How will it work? Will it be at-home testing? How long will they wait to get the test results?
So what we've announced yesterday is that starting today we are implementing an additional layer of protection for Canadians, that is, for those traveling into Canada for any other country than the United States. Once they enter through a Canadian airport, they need to be tested on arrival, either directly at the airport, or if that is not possible, they take a home test and do that home test at home. While they wait for the result of that test to be known, they isolate themselves. And when they get a negative test, they can exit out of their isolation period.
How long is that test going to take? How long do they need to isolate? How long should they expect to wait?
The service standard currently is 3 days. Currently, the majority of results are known within 1 day, but we are telling Canadians that this is a significant change. We are increasing capacity, testing capacity by over 50%. So depending on local circumstances, that could take longer than what has been seen in the recent weeks and months.
And you're saying it's already in place. You're saying it's already in place, but the Prime Minister and Minister Mendocino said it's not yet in place.
No,
and you're saying 20,000 tests, but when you look at the numbers, you need about 37,000 tests a day to accommodate all the travelers that came in last week, for example. So can you clarify?
So the directive to put that into place is now active, so the direction is given as of yesterday, and of course that will take time to implement. It will take time. The speed of implementation will also vary in local airport conditions. There are airports in Canada which can start doing that really quickly because there is excess capacity. Other airports will take a bit more time.
So what's
What
the
are the
deadline?
provinces
What's
saying
the
about? What
deadline?
are the provinces saying about American travelers? What are the provinces telling you about American travelers? Testing them coming.
Well, we all agree that the current focus of our efforts now is to protect Canadians, the health and safety of Canadians from the concerns seen in other continents, in particular around the 10 countries that we have identified, 7+3, but also we've seen variants, the new variant arise in other countries in the world. So this additional layer, because we're speaking about an additional layer, let me remind everyone that in Canada we have probably the strictest border control measures, not only at the current time, but since COVID-19 started in March 2020. That has lasted since then, and we are adding an additional layer, which is the one that I mentioned yesterday. So I think all ministers yesterday recognized that, and we are going to follow the situation.
Is there a deadline? To Stephanie's question, is there a deadline for when everybody needs to be being tested on
J'ai un petit peu de
arrival?
difficulté.
Le délai maximum pour avoir mis en place ces nouvelles mesures-là aux frontières, aux aéroports, ça serait quoi environ? Le délai maximum?
Ça va varier à nouveau selon les aéroports. La directive depuis hier, c'est de faire le plus rapidement mais le plus efficacement possible. Donc chaque aéroport a ses conditions particulières. Dans certains cas, les aéroports doivent travailler aussi, c'est le gouvernement canadien qui travaille au nom des aéroports, doit le faire avec les provinces et les territoires. Comme je le disais, dans certains cas, ça va se faire très rapidement parce qu'il y a un écart important entre l'usage actuel et la capacité réelle. Dans d'autres endroits, ça va prendre plus de temps.
Pourquoi attendre le CCNI avant de prendre une décision sur la troisième dose, alors que bien des pays comme les États-Unis, la France, le Royaume-Uni le font déjà pour tous les adultes, et on a les doses au Canada?
Bien, il y a deux choses, effectivement. C'est qu'on a, on a les doses au Canada pour vacciner une troisième fois tous les Canadiens. Mais deuxièmement, c'est que les provinces, pour l'instant, ont avancé à différentes vitesses. Il y a des provinces qui déjà ont annoncé une dose de rappel pour l'entièreté de leur population adulte. D'autres provinces ont des engagements moins ambitieux, du moins pour l'instant. Alors, pour assurer une meilleure coordination et décroître la confusion que les Canadiens peuvent exprimer, peuvent ressentir par rapport à la situation de la troisième dose, on a convenu qu'on a travaillé ensemble pour ramasser toute l'évidence scientifique dont on a besoin, la confier au comité canadien et voir ce qu'ils en pensent.
Minister, the airport today told us in Toronto, the airport told us that they're not enforcing isolation yet. So you're saying isolation rules are already in place?
Any thoughts on people confused about the new travel rules and the holidays coming up?
Well, I think it's important to put these rules in place because, of course, I don't think anyone knows really what to expect from the new variant. And we got to try and make sure we keep people as safe as possible. And make sure anyone that is traveling and coming back from one of those areas should certainly pay attention to the restrictions and the self-isolation and whatnot. It's the only way we're going to control it. If we don't, it's here. So let's try and deal with it the best we can to keep everybody as safe as we can.
Just about confusion around the new rules and when they're being implemented outside of the 10 countries on the ban list.
No, I haven't heard from any of my constituents that confused in any way. Of course, I'm a member of Parliament from Newfoundland, Labrador, so it's probably not affecting us in a way that it would the bigger centres like Toronto, Ottawa, and other major cities in the country. Take care.
Good afternoon, sir. Any thoughts on the confusion around the new travel rules?
Pardon me?
Any thoughts on the rollout of the new travel rules and some of the confusion coming from Canadians on what this means for potential vacation or coming back to the country?
It is causing some confusion. I have heard from a couple of constituents last night, this morning. I have to look at them closer and to see what they can do to navigate those.
And what kind of issues are they raising?
Again, confusion, last minute. Plans been made. Now the impact, what impact will this have on vacations that have been planned in the last couple of months? So things like that.
Perfect. Confusion around the new travel rules that came in yesterday?
Not yet, no. Certainly, I think my constituents support the moves that we've done as a government to make sure that something's in place. I know institutionally, in King's Hands and in Nova Scotia, we have a lot of post-secondary education with international students that are important, so those will be things that we'll be working on as a government to make sure that those are in place.
Yeah, what are some of the hurdles you are worried about with the international students there?
So certainly, obviously, around the international travel coming in, there's going to be a requirement for testing. So I think as we head into the Christmas season, holiday season, I should say, for some of the international students, that'll be something we have to consider. But those are challenges that we've met and been able to overcome in the past, and I know we will this time. And we got to be mindful right now with Omicron. We don't know enough about this variant right now, so I think most Canadians are supporting the measures that we're taking as reasonable and prudent with what's going on.
Yes, I guess Nova Scotia having some of the tougher regulation on the provincial side, just with the Atlantic bubble and everything. Any talk with your provincial counterparts on if they're looking at bringing back the bubble with Omicron, if it starts to take off more in Canada?
I haven't heard anything on that side. I'm glad that you appreciate the work that we've done in Atlantic Canada through testing and other means. It's a testament to our public health system and the partnership that we've done at the federal level to work with the provinces. But that'll be a question for the premiers on that side, certainly not federal scope. But thank you, because we've worked hard to make sure we've kept it under control.
No problem.
Thanks guys. Take care.
Airports are one of your big issues. Do you have any concern from people back in Regina about just the new travel rules that came in, and hearing about some confusion all over the place here?
I'm hearing a lot of relief that we finally have international flights back to Regina again. I had a lot of travel agents and other people say, hey, we would like to book these direct flights and sell these vacation packages for Christmas and for the winter. So, no, it's been mostly positive from my constituents.
Well, but with the rules yesterday and just the need for the test on arrival if you're coming from anywhere aside from the U.S. and the new quarantine rules coming in, any concern coming from the constituents there and just confusion around the rules with all this coming up?
I haven't heard that one, but I suspect people have been used to these rules for so long that it's maybe a little bit of frustration, but certainly nothing that we haven't been used to for quite some time.
Perfect. Thank you, sir.
Okay, good to see you again.
See you around. Are you hearing any issues from your constituents on confusion around the new travel rules? You're hearing lots of Canadians wondering what the new rules could mean for their winter holidays, and I was wondering if you could hearing any of this and if you're bringing it to the cabinet table.
Well, those are clarifying those rules are active discussions. We just introduced the rules yesterday, so this is natural and normal, and we'll explain the rules as we should.
Thank you. Have you heard any update on when we're going to see the arrival test?
Hi there.
Any update you can give us on when you may see an update on the pre-purchase agreements for some of the antiviral pills Health Canada's looking at?
Well, we are in discussions, and we'll have more to report soon. But we are in discussions on the antiviral, yes.
But when would soon be with seeing the approved in that?
Well, it's soon, and as soon as I'm able to give more information, I'm going to be happy to do that. So stay tuned.
Minister Rodriguez. Good afternoon. Any reason why you can tell us why MPs are going to be awarding the Queen's Platinum Jubilee medals this year?
Well, we're looking at the different options at this moment to see what's better to celebrate the event. So we'll have more information later.
What kind of options are being looked at before?
Many options. Different.
Any worry from your portfolio just with international workers potentially coming into Canada that the new rules could slow things down for employers? Sort of trying to bring in any relief workers that may be.
Yeah, no, look, I mean, I think our argument first and foremost is the best thing we could do for the economy is end the pandemic. That is the best thing we can do for employers and for workers. So, obviously we're taking Omicron very seriously, and we've got to make sure that we stay on top of it for employers and for workers.
And have you hearing any concern from your constituents about confusion around the new rules? Just looking around, it seems like there is a good deal of confusion on what exactly happens when you're getting to the airport. Is the arrival test going to be paid for? Is it not going to be paid for? How is quarantine going to work for people? Has this been coming up in your constituency at all?
Yes, it has. But I have to say this, all with the clear understanding, especially at home where we have the highest vaccination rate of any province. They just want to be safe. So, it's not a kind of an irritation so much as it is like an inquisition. Like, just tell us what to do so we can do it, because we all want to be safe and stay safe.
Yeah. And on the labor side with, with 5G technology going to be essential for many, many businesses.
Which technology?
5G. Yeah. Sorry, we'll have to move on to Mr. O'Gab.
One last question.
Know more on when the final rollout will be happening for full implementation of the arrival tests with the new travel restrictions?
Look, we're starting testing right away. We're ramping up the capacity. In the coming days, we'll reach full capacity, but testing has started already right away.
When do you expect to reach the 32,000 goal?
In the coming days.
Will that be by the end of the week?
Thank you.
Early next week? Concerned in the tourism portfolio with the new travel restrictions coming in and just some of the confusion among Canadians on how exactly everything is going to work as they're at the airport?
Yeah, it's a great question, and let me say this, that the tourism sector is the most hardest hit sector in the country, and the Canadian economy is not going to recover until the tourism sector does. And the Tourism Industry Association of Canada is in town this week, and I spoke at their conference yesterday, and I said to them, and I'll say this to Canadians, that safety first, and then what happens is travel's got to follow. but we got to stay safe first. And so we're going to do what we have to do to manage Omicron. We're going to keep Canadians safe. We're going to keep the traveling public safe. But we got to be ready so that when we are through the end of the pandemic, that we can be ready to travel again. And so it's safety first, travel, because the Canadian economy doesn't recover until the tourism sector does. Thank you.
I've been hearing any issues from your constituents on the new travel rules. It seems like a lot of Canadians are confused about exactly what is going to be needed at entry points to get back into the country if they are abroad.
Not really right now. My constituents are looking forward to the federal government and the provincial government and municipal government to work together and better protect them in the fourth wave. And hopefully this new variant is going to be under control and not to force the government to have to shut down the economy again. And that's the last thing we want to see. Yeah, thanks a lot.
Any issue from your constituents about the new travel rules? It seems like a lot of people are very confused about what exactly is going to be happening as they arrive with confusion around the
we've been getting some
rollout.
calls just on what are the rules. I think that's been the confusing part. Things have been changing quickly, so we've been trying to make sure that we give them the information that we have.
And just any concern on your end with lots of health experts, including the World Health Organization, saying that some of these travel bans, may not be that effective, and the cat's kind of out of the bag when it comes to Omicron, and we're going to just see spread.
I think what they do is they actually give us time to sort things out. So it's kind of like a quick break to give us time to figure out what to do in Canada. We have to make sure that we protect our borders. Thank you.
Thank you, sir.
Hi, guys.
Have you been hearing any issues around confusion with the new travel rules from your constituents just on how things work at arrival?
Sorry, didn't hear that.
Oh, sorry. Have you been hearing any issues from your constituents about any confusion around the new travel rules for what happens at arrival at the airport?
No, we have posted it clearly and linked it to all the details on social media. We haven't heard from anybody yet. Thanks.
Good afternoon, Mr. Fergus. Oh, bien, ça va?
Très bien, how are you?
Oh, good. Just wondering, have you been hearing any issues from your constituents about confusion around the new travel rules? It seemes like a lot of people don't really know what happens at the border.
Not yet. I mean, the announcement was just made yesterday. So, and this morning I've been in caucus, so I haven't heard from my constituents yet. But I'll check in with the team to see what they're hearing. Thanks.
Qu'est-ce qu'on vient de voir? Bien, je pense que c'est un beau moment pour tout le monde. Il y a des gens qui avaient peut-être des doutes sur notre position. Maintenant, je pense que c'est clair. Il faut mettre fin à ces thérapies de conversion. Puis c'est dans un vote unanime aujourd'hui là, qu'on a vu une Chambre des communes qui se ralliait à cette position, là, cette proposition que l'on faisait aux autres partis. On leur tendait la main, qu'on passe à d'autres choses et qu'on s'assure de protéger toutes les personnes qui prévivent ces situations malheureuses.
Donc, ah, parfait. Ben oui,
Pourtant, il n'est pas si grand que ça. Hein? Là, vous ne mettez pas Saint-Fauman, hein?
C'est un message, d'une certaine façon, que vous essayez d'envoyer à la population canadienne de la part du caucus conservateur.
Oui, tout à fait. Puis depuis le début, on a dit que c'était un vote libre. Puis on s'est parlé. Puis je pense que tout le monde était unanime. On est d'accord avec le fait que ces thérapies-là doivent finir. Et le projet de loi, bon, on avait des questionnements. On l'a débattu. Ça faisait 3 fois qu'il était ramené à la Chambre des communes. Il était temps qu'on envoie un message, tous les partis ensemble, pour dire qu'il fallait mettre fin à ça. Donc, vous l'avez entendu par notre responsable du cabinet fantôme qui a proposé un consentement unanime de l'ensemble des parlementaires pour qu'on puisse accélérer le processus et qu'on arrête la partisanerie qui était autour de cet enjeu-là.
Aidez-moi à comprendre, parce qu'il y a 6 mois, il y avait, on va se le dire, de l'obstruction de la part de certains membres du Parti conservateur pour ralentir l'adoption de ce projet de loi-là. Ouais. Aujourd'hui, vous entendez pour l'adopter en une journée. Comment est-ce que vous réconciliez ces deux positions-là?
Bien, la dernière fois, il y avait des préoccupations par rapport aux parents qui voulaient discuter de ces enjeux-là, des gens qui avaient des questionnements, qui avaient peur que ça soit criminalisé. Il y avait des amendements qui avaient été emmenés, qui avaient été refusés. Mais sur le fond, on l'a dit, on l'a répété, puis je me mets au défi de compte d'entendre tous les discours de tous les députés conservateurs qui ont été faits en Chambre. Tout le monde était unanime, on était contre les thérapies de conversion. Maintenant, la nouvelle mouture qui a été proposée a amené quelques modifications qui a fait en sorte que tout le monde était à l'aise de supporter ce projet de loi suite à la recommandation de notre chef aujourd'hui en caucus. Et on est allé de l'avant. Bien, je pense que là, les gens ont moins d'inquiétude par rapport à ça. Puis on voulait envoyer un message clair que ces thérapies étaient inadmissibles. On devait protéger les gens qui peuvent vivre certaines pressions. Il y a des êtres humains qui vivent des moments malheureux à cause de cela. Aujourd'hui, on voulait envoyer un message clair dans l'ensemble du Parlement canadien.
Merci beaucoup, M. Reyes.
Plaisir. Bonne journée.
Merci beaucoup d'être venu. Après des déficits de 500 milliards de dollars en 2 ans, le gouvernement a causé une énorme inflation ici au Canada. Une inflation le plus haut depuis 2 décennies. Et les Canadiens payent des prix plus élevés à cause des dépenses gouvernementales plus élevées. Maintenant, le gouvernement libéral veut ajouter un autre 7 milliards de dollars d'inflation avec le projet de loi C2, sans imputabilité et sans décrire exactement où les dollars seront versés. On a vu déjà que le gouvernement a versé la PCU aux crimes organisés, aux prisonniers, aux soupçonnés de la fraude et aux gens qui auraient pu travailler avec plus de 500 000 emplois non comblés. On a vu des grandes sommes, des milliards de dollars pour les grosses corporations qui avaient déjà assez d'argent pour payer des dividendes et des bonus à leur PDG. Donc, les conservateurs veulent savoir que chaque sou soit bien dépensé. Donc, par rapport à ce projet de loi, nous, pour obtenir notre appui, nous revendiquons que le gouvernement atteigne quelques conditions avant le vote. Premièrement, nous voulons les financements et un mandat clair pour une enquête indépendante sur le rapport de FinTrack que le crime organisé a obtenu l'argent de la pandémie, plus spécifiquement à le PCU. Deuxièmement, nous voulons rétablir le comité des finances pour une étude totale de ce projet de loi, y compris 4 heures de témoignage de la ministre. Troisièmement, nous voulons des amendements à la loi pour garantir qu'aucun autre argent sera versé aux gens qui seront capables de travailler, étant donné qu'il y ait plus d'1 million d'emplois non comblés aujourd'hui. Et finalement, nous voulons des amendements pour prévenir que l'argent des contribuables est dans les poches de la crime organisée. Donc, celles sont nos conditions. Sans atteindre ces conditions avant le vote, les conservateurs vont s'y opposer. Thank you very much for coming. As you know, this government has had $500 billion of inflationist deficits over the last 2 years, driving the inflation rate up to a 2-decade high, meaning higher costs for Canadian families. People cannot afford to gas their car, heat their homes, feed their families, or buy a house for their young people. This is the result of too many dollars chasing too few goods. What do you know? When you spend more, it costs more. Now the government wants to throw out another $7 billion of inflation without any scrutiny. With Bill C-2, the government is proposing new expenditures without enough accountability. And we already saw with pandemic spending that the Liberals gave money to organized criminals, they gave CERB checks to prisoners, and ordered public servants to pay out benefits even in cases of suspected fraud. Meanwhile, with the economy open and 500,000 jobs unfilled for over a year, the government kept paying people not to work. That number has now risen to 1 million unfilled jobs. And still, this government pays people not to take those jobs. And so we're setting conditions in order to get our support for this bill. These conditions must be met or we will oppose it. Condition number 1, we want a full funded independent investigation into FinTrack's reports that organized criminals on CERB benefits. 2, we want the Finance Committee back up and running to do a full and complete study of this $7 billion of expenditure, including 4 hours of testimony from the minister. From those to whom much is given, much is asked. If this minister wants another $7 billion, she will have to answer questions about where the money is going. 3, we will insist on amendments to the bill to prevent any more payment of benefits to people who could be taking the million available jobs that employers are desperate to fill. It is not acceptable for people to get paid to stay home now while there are help wanted signs literally on almost every street corner. Paychecks should replace government checks. We are not in spring of 2020 when people were locked down and prevented from working. Now there are more jobs than there are people, and we want workers to fill those jobs. Finally, we want amendments to this bill to ensure that no more organized criminals, fraudsters, and prisoners get benefits from the government. Of course, Conservatives from the very beginning supported giving assistance to businesses and workers who were locked down by their governments. We even believe in compensation for the tourism sector, which continues to face ongoing restrictions on visiting from abroad, restrictions that may intensify. But we want accountability in how the dollars are spent. So we have set forward 4 reasonable conditions to get ongoing Conservative support. We invite the government to meet those conditions in order to do so. Thank you.
Mr. Poilievre, what benefits are actually paying people to not work? Because the new ones, you have to be under a public health lockdown to qualify, and service expired. So what are we talking about?
Well, you mentioned one of the benefits. There are a multitude of benefits that the government has kept in place even after the CERB program has lapsed, and we want guarantees that that money only goes to people who could not otherwise be taking jobs.
So are you going to propose amendments, Mr. Poilievre? Are we going to see them on paper?
Yes, we will oppose amendments at committee, but we want commitments that this will get support from the government before we would support the bill. Excellent. Merci beaucoup.